the starting point is really with what is PTSD and understanding the impact of trauma on our bodies and our minds, and just generally having a sense of what happens to us as human beings. And I'm going to talk more from the position of just being a human being, which we all are. And I think that's a better starting point than us just thinking about ourselves from a clinical perspective, although that may be of great interest. The reality is that trauma is the ultimate human equalizer. We all experience things in our lives that can be very, very difficult, clearly can be potentially devastating. And so, what I really want to do is spend our time talking about that. Everybody now knows that I'm Anna Baranowsky, and I'm a clinical psychologist, and I'm the CEO of the Traumatology Institute. And really, our goal with this organization is to help professionals and volunteers help trauma survivors. And I'm the author of Trauma Practice Tools for Stabilization and Recovery, and What is PTSD? 3 Steps for Healing Trauma, which just came out last year. And we've received a lot of good feedback. The first book I mentioned is really a clinician book, and it's geared towards people who are trying to help individuals after trauma, whereas What is PTSD? 3 Steps for Healing Trauma is really a book that is for the general population, people who are trying to understand what they can do for themselves after trauma. And I've dedicated my career to working with trauma survivors and training professionals who care for people after trauma. And I developed this presentation for anyone who struggles with the aftermath of trauma, or for the professionals or volunteers who help trauma survivors or deal with related symptoms such as anxiety, depression, post-traumatic stress, dissociation, and other related difficulties. We have to understand what happens to our brain after trauma in order to do a good job of trauma recovery. And it's important to recognize that the brain and the body cannot be separated, and they correspond perfectly in response sequence that is orchestrated to aid us in the greatest potential for survival during a traumatic event. There has been a new classification with trauma now being identified not as an anxiety disorder. And this is because we understand that not all traumas result in a fear-based response. And what does that really mean? Now, I work with a lot of individuals who have military or paramilitary training, and in their training, what they've done is they've learned, they've recognized that training kicks in when they're exposed to major events, and that instead of feeling fear, they just start to act and respond to the issue at hand. And for other people, fear is not what kicks in at all in the early aftermath. Really, what kicks in is our survival mechanism, and I'll talk about that coming up shortly. So, with the new changes in the diagnostic criterion in DSM-5, the prevalence is showing to be lower comparison to DSM-4, and it appears that the primary reason is the removal of PTSD as a result of sudden death of a loved one due to natural causes. This was a criterion that was always a little controversial, but now it has been removed. And in fact, that may result in a deeper exploration into the issues related to bereavement and grief responses, particularly those that are long-term and complex. So that's a good thing for individuals who are struggling after the death of a loved one. Another important update is the removal of criterion 2, which has required that individuals have a reaction of fear, helplessness, or horror, which, as I said before, isn't always the case. The DSM committee did an excellent job of capturing the new criterion now called negative alterations in cognition and mood, which emphasizes um, in the self or appraisal and mood begins to worsen since the trauma, and it includes dissociative features like negative expectations or distorted blame, negative emotional state, diminished interest or participation in important life activities, detachment from others, and anhedonia, which is basically the inability to experience joy in what we are encountering in life. And this often means that people stop doing the things that they might have enjoyed previously in life. But this particular new criterion is a very, very important one because it really captures something that had been missing, which is this negative alteration in cognition and mood. So that's a very important one. It's the continuum of post-traumatic stress responses. And this is important because I really believe that when we experience a trauma, there is a range of responding from assimilation and growth to severe reaction. And often the type of trauma that we're exposed to determines the level of response. My trauma doesn't equal your trauma, which means if you're working with trauma survivors, somebody might come in and tell you a story that you think is quite horrific. And of course, given that we're all unique, they may not actually experience or develop PTSD, and yet somebody might come in and describe something that you think is manageable, and they actually do have the symptoms that are consistent with PTSD. And we need to be responding in an honorable way to what we're hearing from our clients, exactly what their story is and the effect on them as an individual. The National Association of State Mental Health Program did a good job of defining trauma as the personal experience of interpersonal violence, including sexual abuse, physical abuse, severe neglect, loss, and the witnessing of violence, terrorism, and disaster. So things like motor vehicle accidents, violent assault, a natural disaster. Well, it seems like those things would really classify as a trauma, right? I mean, that makes sense. But this really simplifies the human experience. And obviously, there's more to it than that. So then we have to look at our survival mechanism, which is hardwired into all of us. And it helps us to respond before, during, and after a trauma. You know, having a survival mechanism is actually a good thing because we need that to keep ourselves well and out of harm's way. So, how does our survival wiring impact trauma response? As I mentioned before, trauma is the great equalizer because trauma knows no boundaries of country, of race, of gender, or any other element that you feel may make you different or the same. And our survival instincts ultimately define trauma regardless of what you might think about a given event. This is a chemical response in our body, and certain parts of the brain live beneath or outside of our conscious awareness and respond to these life events. And as a result, there's a chemical release that's normal after trauma and results in the body responding directly to the chemicals being released. And this is what makes all of this automatic and unconscious. I was working with a client recently, and she comes in and she says to me that she just feels so guilty and so bad that she's not okay yet, and yet so much of her response is really automatic and out of her immediate control. Once she learns how to work through and manage her trauma symptoms and get control over what's happening with her, she will have some choices, but until she gets that help, until she gets that ability to process through and to deal with the stabilization after trauma, these reactions can be so below the surface and so automatic that we don't have any choice in the moment. And I know that everybody sitting in that room understands this because we're all wired the same way. What happens if we add the lens of helplessness into trauma response is that we immediately recognize that having no ability to get out of danger is ultimately traumatic. Being unable to escape a trauma results in a psychosocial event that engages the self-protection mechanism, automatic, impactful, and absolutely in the moment, leaving us feeling that we have no ability to cope. Helplessness engages our natural mechanisms of survival, and this is a big impact on our body. One that is automatic and ignites our entire being. And the body now is responding by igniting the chemistry of survival: fight, flight, or freeze. And these chemicals work hard to protect us, helping us to endure or survive potentially life-threatening events. So sometimes we can experience one thing that isn't actually dangerous, but certainly leaves us sitting at the edge of our seats. There's definitely a benefit to having an automatic response, scanning system for potential threats, and the chemical response which allows for rapid responding. That's what we need in place in order for us to get out of harm's way. However, this can also backfire as the same mechanism can misinterpret information and become reactive when there's no real threat, or in some cases, our neurochemical release continues to ignite repeatedly long after a threat has passed, even years after the threat is gone. We are all potentially at risk of igniting in a self-protective way. And in fact, this tendency creates habits that stop being useful after the threat of trauma is long past. Many of us have habits such as chronic pain, depression, anxiety, fear, tension, anger, PTSD, dependency, and learned helplessness, which are common patterns associated with exposure to severe traumatic events and can become interrelated habits, undermining our ability to manage everyday life or gain and enjoy in day-to-day activities. So sometimes we experience trauma, and then those traumas form and inform us, shape us, and they change how we are and how we react in our everyday life. These habits result in potentially long-term chronic patterns and in physiological changes in our bodies and subsequently in our everyday lives. And the very state of fight or flight that was so important to our survival becomes a habit, resulting in chronic conditions and the resulting search for help for our chronic problems with initially no obvious solutions, even though most of this is ignited by many false alarms or incorrect perceptions of threat. Now let's think about how the body reacts to trauma, and the part of the brain that controls all of your survival instincts is the autonomic nervous system. You'll see that in pink at the top, and there's two branches, sympathetic and parasympathetic. And you'll see in the sympathetic side that that's really all about the fight or flight, and the parasympathetic side is all about rest and digest. The system operates automatically, and it manages every system in our bodies. And this is important to consider because if you work with trauma survivors frequently, what you learn is that people might start to come with you with feelings of anxiety, fear, stress, depression, all sorts of symptoms, but they also start to describe body-related symptoms as well. So consider this. This is the autonomic nervous system on trauma. And because the autonomic system controls a long list of systems that truly run our body, and when the autonomic nervous system is in a state of automatic fight or flight or fear response. There's a lot of things that can go wrong when we reflect on all the systems and how they can become responsive and in a chronic reactive state. Our integrative body, our skeletal body, muscular system, nervous system, endocrine system, that's your hormones. Cardiovascular system, that's also known as your circulatory system, your blood and your heart. Respiratory system, the integumentary system, which is, your skin and hair and nails. Your lymphatic and immune system, digestive system, urinary system, and reproductive system. Boy, it's exhaustive. And imagine if the autonomic nervous system is in charge of all of this and it's sending an alarm message, we're in trouble. When the autonomic nervous system engages the survival mechanism of fight and flight, this engages every single system and all the connections between them to prepare for extreme action, to get away from danger right now. And we frequently get this wrong, leaving us depleted. This is particularly an issue when people have experienced complicated trauma. The autonomic nervous system, managing all of the systems, the tissues and organs, and how everything works together, every single day of the week, 24/7. So when the autonomic nervous system says fight or run away, we really want to pay attention because every cell and tissue is listening. And this is really devastating when we have PTSD, especially if the body is telling us there's danger when in fact there is no danger. Finding balance, when you do manage to get away from danger, is essential to our well-being. And we have to recognize that even if you do manage to get away from danger, then the autonomic nervous system, in a perfect world, turns off the reaction and the body returns to a normal state or homeostasis. That's balance, and that's definitely what we want. We definitely want the balance in the body in order for us to heal and recover. So here you see George. No, of course not, George. We knew straight away it was a false alarm. And here's this person underneath the table, and it doesn't look like they thought it was a false alarm at all. So when the autonomic nervous system becomes a threat to the body itself, and believe me, this happens all the time with chronic and complex trauma, and often even when somebody is in the early stages recovering after a trauma. As it continues, the autonomic nervous system continues to ring in threat where none exists, undermining our overall well-being and reducing the body's ability to return to balance. When the autonomic nervous system is stuck in an instinctively driven fight or flight protection, it leaves all the systems struggling for survival underneath the surface. Well, the real problem is the ringing bells and whistles that are associated with that instinctive response system, our mechanism for survival. What happens when we don't escape, or when the brain and body remains convinced that we remain in danger? And this is where the real problem begins. And you're going to see the iceberg on the top, and there's loads below the top of the iceberg. And I've again shown you an image of all these different systems in the body and how when the autonomic nervous system is ringing, it's impacting everything. And so when your clients say they can't rest or they can't digest or they can't think clearly, this is why. The brain and the body begin to drive very hard and fast when the mechanism of survival, that fight or flight mechanism, is ignited. And we're really not designed to be driving hard and fast all the time. Our bodies are meant to sustain a state of calm. in order to survive. Otherwise, we start to feel depleted, get sick, break down, and our lives are just not what they're meant to be because we are overworking ourselves. So, again, let's talk about this idea of habits becoming chronic conditions. And the habits of trauma generally lead to patterns that have dramatic physiological and psychological impact. And when we have habits associated with trauma, these become chronic and habituated in the bodies, and they become emotional drivers in your life. So everything that's underneath the surface is now driving the body. And then we need to think about the habits again and how they lead to patterns that have dramatic effect on our minds, our bodies, our physiology, really. And ultimately, all of this shapes how we function every single day and creates that chronic list of conditions that we now understand is really driven by the autonomic nervous system. Here's a list. It's a very limited list. There are a lot of things on the list, but there's so many things I could put on a list of traumas. All of these things have the power to ignite our nervous system in a fight or flight reactivity. And I want you to just ask yourself for a moment, how many of these things might have been part of your life history and how have they shaped you? Because if you're going to work with people who have experienced trauma, understanding your own response to trauma, your personal reactivity, can help you tremendously on two levels. One, you begin to understand what it is you need to do to be well, where the areas of your own vulnerability are, where your own triggers are. Because if you're working with trauma survivors and you have a particular kind of trauma, then if somebody comes to you with a similar history, you may find that that's an area of vulnerability because their trauma can remind you, become a trigger for your own trauma as well. So this is important from a clinical perspective to understand and recognize our own vulnerabilities as professionals and helpers. So how common is this? Well, it's pretty common actually. 70% at least will be exposed to some kind of trauma in their lifetime. General statistics range from 8 to 25% resulting in PTSD. There was a recent online structured survey in the Journal of Traumatic Stress 2013, and they found that 89.7% of individuals in a sample of 2,953 expressed multiple trauma exposures in their lifetime, and PTSD was endorsed at 8.3% of that online sample. So it's pretty common, much more common than was thought in the past. So it becomes a problem because old traumatic memories can easily reignite our autonomic nervous system in a response mechanism for survival. Now, just for a moment, imagine that you were severely bullied and threatened when you were much younger. Maybe you were in school, maybe at some other point in life. And then every time you encounter your boss, who you see as kind of a harsh and demanding person, you feel that your own personal history of bullying gets reignited. Now, this is going to cause trouble for you because this is a reignition. It's like trauma is reoccurring in the moment, and you feel the same feelings of fear, anxiety, and dread, kind of like you did when you were younger in school and really vulnerable while you were being picked on or bullied or beaten. So our history, our past, becomes ignitable in the present. So there's a predictable pattern of reaction, and some of the things that we know we see consistently: rapid heart rate, shallow breath pattern, elevated blood pressure, strong emotions, anger, fear, anxiety, depression, negative perceptions. Remember that one, that's important. Withdrawal from normal activities, tension in our fists and jaw, digestive problems and butterflies in your stomach, and poor decision making, chronic pain, stress, tension, dry mouth, clammy hands. You might wonder how all these reactions are predictable. Well, they are universal for all of us because they represent the impact of our instinctive survival mechanism on the bodies. When this becomes a chronic response and begins to deplete our ability to cope and to tolerate any further threat perceptions. Lower levels of threat begin to result in chronic conditions. So what does that really mean? This is actually something we have to take into consideration, because now things that might not have bothered us in the past can create a big startle response and a perception that something is very dangerous or life-threatening. Even when we assess it and reflect on it, we realize that it's not. We can feel awful, shaken, and re-traumatized when we look at this picture that reminds us of a terrible time, even though it's not happening right now. And this is a pretty powerful picture because it shows how the mind stores memories along with emotions and how they get locked in the body, and that this can ignite even when we're safe in the moment. Just think about how this makes you feel, what you were doing at the time, who was around you, and how others responded, and especially what was the look on the faces of the people around you in this moment. Many of us have very distinct memories of what they were doing in that precise moment. What do we do to begin to break the habit of nervous system ignition? Cutting-edge approaches in neuroscience have helped us to understand that we can harness our natural ability to harness, calm, and retrain the autonomic nervous system, or break habits and learn new ones. We know that stabilization exercises must be at the root of recovery because this is what is required to retrain the body and the brain, something we are all wired to do as well. Our bodies allow us to retrain this reactivity, that autonomic mechanism for survival. Just like we're able to form a habit out of reactivity, we can form a habit of relaxing the body and saying settling and stabilizing things to reassure our minds. There are a lot of examples of how to achieve this. And one of the things that I will talk about in a little while is some of the things that we've created at the Traumatology Institute, some simple tools along with a 30-day challenge and some breath training exercises and applications. And I'll give you an example of that shortly. But first, let's think a little bit about the amygdala and the hippocampus, because they are both very strongly implicated in what's happening when we get a fear trigger. So one of the things that we understand is the hippocampus. It's the area in the brain that is involved in memory storage, while the amygdala is the fear center. So if we perceive something that we understand as fear-inducing, threatening, dangerous, then we may go into an automatic response cycle because the amygdala may bypass our normal, slower route to assessing threat. And in the case of that image I showed you previously with the man at the party, he was startled, and yet there was no real threat. And that's the amygdala firing quickly to send a message of danger that's incorrect. And sometimes the hippocampus has stored memories along with the associated emotional content. This is important because what can happen is the experience of the memory gets triggered, and then all the emotions of fear, anxiety, and the perception of danger get ignited here. So we have the amygdala, that fear control center, and if we go the slow route, we say, is this a correct response, the feeling of concern or worry? And we assess it. And if it's not, we don't do anything. We just relax. And if we say, yes, there is something to be worried and concerned about, then the amygdala will fire off very rapidly a ignition to the whole body, and the autonomic nervous system will start to react. So, but the big piece here is that sometimes the amygdala gets it wrong, and we need to slow down and give our body a chance to assess content more accurately. And here you'll see a simple list, and it starts with trauma therapy, psychotherapy, evidence-based, triphasic, starting with stabilization. Now that's the important part. Starting with stabilization, because now you really understand deeply that without the stabilization, the body can just continue responding as if the situation is dangerous when maybe it's not, and have a chronic habit of ignition. So when I do work with trauma survivors, I always start with stabilization. One being the stabilization video program, which is a 30-day video stabilization series. All the programs are under 10 minutes, and they expose you to some of the approaches that we have found very useful. And I use it as adjunctive therapy with my clients right now, in that I'll see my clients and then I'll put them in the video stabilization program so that they can actually, every single day get a corrective message to the body and the mind to stabilize. And in addition to that, we work with some breath trainer applications that we've been getting good results with our clients with as well. Very simple. I'm going to show you that shortly. Obviously, we want to encourage, if needed, research-based pharmacotherapy, physical therapies, psychosocial response, spiritual care, and complementary and integrative approaches as needed. So I just want to make sure that you can see the breath trainer on your screen. Can somebody put their hand up to show me that? Thank you. It's hard. It's actually a little blurry on your end. So what I'm going to do is I'm going to run this breath trainer. And your only job is to watch the icon get larger and smaller, follow the instructions, and let the feeling of relaxation start to embed both in body and mind. I really always work within a CBT approach, utilizing stabilization, exposure, and reconnection. But there are many other things for us to consider as well, including psychoeducation, telemedicine, web-based interventions, and our newest program, which is the trauma treatment online program as well, so that we are really moving into different things that might be helpful for individuals. So consider this one. I really like this new application, the PTSD Coach, which is free for people to download. And if you have a smartphone, the PTSD Coach can be accessed. And it's a very useful tool that has a lot of different resources. And just for your own toolkit, you might want to have something like that available for yourself as well. We also have the Trauma Treatment Online Coach, which is an online program that offers adjunctive therapy for clinicians and individuals struggling after trauma. This is so in between therapy sessions, the people that you're working with can maintain their progress and keep on track. And they also get, as part of the Trauma Treatment Online Coach, the 30-day stabilization program and access to the Breath Trainer app, but many, many other exercises as well, just to keep them moving forward and on track with that stabilization. Pharmacological approaches can be very important when prescribed through a qualified practitioner. And some of the ones that we're recognizing as being most strongly supported are fluoxetine, paroxetine, sertraline, and the SSNI venlafaxine is strongly recommended. Now, for people who are having sleep or nightmares, prazosin has had some very good results as well. And so, recognizing that these might be helpful and that your client may benefit from a referral to a psychiatrist for a proper assessment and pharmacotherapy. So I also suggest, that when people are able, that they may want to use physical therapies as needed, acupuncture, physiotherapy, massage, mindfulness, whatever is a good fit for the individual. And the one thing that I will encourage all of you to do is get access to all of the resources that I'm going to give you today for free. If you write down learn@psychinc.com and ask specifically for changes to PTSD 2313, which includes our brief screener, which is updated, our 30-day challenge, and the breath trainer link, and I'll make sure that my assistant gets all of those things to you. I do hope that this material has been meaningful to you and provides you with a good foundation of understanding what happens to us after trauma, from impact through to recovery. Remember all the resources that are available through the Traumatology Institute TickLearn and whatisptsd.com. Wishing you a gentle day.